Good morning, guys. Welcome back to our mess, and we are it's about 5:43 in the morning. Woo, camera's moving around a lot. We are headed to the hospital for surgery this morning, so maybe I thought we should kind of bring you guys along for what we can. I'm not going to do any filming in the hospital probably, but
especially not today.
Yeah, I'm going to be kind of loopy. And my poor wife can't even go in the building, apparently.
No, and they're in El Paso. We're not allowed. I'm not allowed to even go in that building.
So, we'll. I have to be there by 6:30. It's about a 30-minute drive. We'll be just a little bit early, hopefully. Traffic allowing.
I was always told if you are not 15 minutes early, you're already late.
So, we are on the road. Not much else to say at this moment. As soon as we get there, I'll give a quick little update. Just bring you back for snippets here and there. So, welcome back. Alright, so we're here, and so maybe let's get ready to go in for surgery. Because I'm not going in there.
If it were me, I would not be having surgery because he can't go with me. Then they'd have to let you in.
It is you.
Yeah.
You're going to do it by proxy.
I'm going to do it by proxy. Okay. I don't think it'll take away your pain.
So this is not going to take away my pain either.
It's like somebody, I don't remember who it was, said that this might relieve some of your pain. And not all of it, but might relieve a little bit. Especially with that one screw that is sticking out and you can't even lay your foot on stuff because
it's really not that bad.
Oh my gosh.
So again, guys, just to remind you again, today I'm just having 4 screws taken out of my foot in preparation for having the joint replacement. So
if you see the doctor today, ask him if you can get copies of all those pictures.
If I am coherent enough, I will do that.
If you see the doctor before surgery today.
Okay. All right. So I'll try to get a quick little flash in the hospital, but no guarantees. If not, then I'll see you afterwards.
Yeah. Maybe I'll video him. All loopy. We'll see. I can't go in the hospital and video him right after. So, and I know the last time was it when with your ankle that you came out of the anesthesia and were slapping at the nurses because they were trying to put that you had the oxygen on and you were trying to take the oxygen mask off and the nurse had to almost slap your hand because you wouldn't leave it alone. So he's funny. Of course, I'm pretty sure I'm funny too. So anyway,
see you guys in a bit. Good morning, peoples. So it's Wednesday morning now, 2 days after the surgery. Sorry I didn't get on yesterday. I was
recovering.
That's a good word for it. So surgery went well. I guess it was successful.
It was successful.
I had a little bit of a hard time coming out of anesthesia apparently, and when the doctor came in to talk to me, I was still not coherent enough to do that. So I didn't get to talk to him to get the whole scoop on everything, but apparently it was pretty rough.
Yeah, you had a nurse call yesterday and check on you, see how you were doing, and she said it was rough getting those screws out. Of course, almost 20 years.
Yeah.
Them growing in your bone.
So surgery was on Monday morning. It's Wednesday morning. I should be seeing him for a follow-up on Friday, but we have a wedding to go to this weekend. Talk about stacking things on top of each other. So we moved my appointment up to today to go see him, so I can get the scoop and we can find out the do's and don'ts and whatnot. So anyway, it was successful, and once I find out the whole story about how bad it really was, I'll get back on here and share it with you guys. That's where we are. All right, guys. So say hi.
Hi.
We're actually in the doctor's office. They stepped out for a minute, but let me show you. Put my hand in the way. Let me show you what we got. Pretty nasty. So to make you all aware, there were 2 screws that went here that way, and 2 that went that way. And they took all 4 of them out. This is kind of hard to film.
You need it?
Nah, I'm good. So, doctor's gonna come in here in just a moment and take a look at it. Tell me the story of what went on and how bad everything was, and
Or how good everything is.
right. And again, to reiterate, this is step 1 in a bigger process. So, I guess they're gonna wait, I don't know, 4 or 6 weeks or something. And I'll be going back in for a total joint replacement, which sounds delightful. But they had to get the screws out of the way first. Give me a little bit of time to heal up. And we'll get on to that. So you're not in the screen, baby. It's hard to.
Better.
There we go.
I'm glad you did all that to get me on the screen.
Anyway, guys, we'll probably cut. Well, I don't know. I'll come back because I wanna tell you guys what he had to say. So I just wanted to show you guys that real quick. For those of you who have weak stomachs, sorry. Well, we are now out of the doctor's office and got some interesting news. So, to the doctor's credit, before I had the surgery, he told me this is one of those surgeries that should take 5 or 10 minutes, but you never know what you're going to get into. He said that. He's very well aware that Murphy's Law always comes in.
His nurse jinxed them.
So, he said what should have been a 5 or 10 minute surgery wound up being a 90-minute surgery. All 4 screws broke off. All 4 of them. The heads just spun right off. And apparently had to do quite a bit of bone removal to get to one of them. So because of that, they got the screws out. He said he wished he had filmed it. Would have been an excellent learning video.
Or teaching video.
But because they had to take some bone out and everything else, they had to put in a bone compound to fill in the gaps and to harden. So because of that, he originally told me that we were going to be going in, like I said earlier, for the total replacement in about 4 to 6 weeks. Well, now he's looking at 3 months. So I'm going to be off this foot for 3 months, letting that compound harden, because when they go in there to make their cuts and everything for the new joint, that needs to be solid, or else it's just going to mush up and not adhere to anything. So whatever. I mean, not ideal, but we're getting something going that should have been taken care of a long time ago, and the screws are out. So for the first time in 17 years, I don't have any metal in my body right now. But here in a few months, I guess I'm going to have some metal in my body again. So, but anyway, that's where we are, guys. I think we'll cut the video right there.
Yeah, I think.
Thanks for sticking around.
That's all we got.
I'll keep you guys updated on how things are going as time progresses. We'll see y'all later.
Bye.